Hello everyone, my name is Dr. Izioma. I'm here to talk about a common problem children face, and that is diarrhea. We've all experienced it one way or the other in ourselves and even in our children. So let's talk about it. Diarrhea is derived from a Greek word that means to flow everywhere, and we define it as a passage of stools 3 or more times within a 24-hour period, loose watery stools, or at a frequency that is higher than what is normal for the child. Is very common in under 5 children, but worse in children less than 2 years. And then you want to make sure that they don't continue. It can be problematic. We have about 4 clinical types and include the acute diarrhea, which is a common one we usually see, and it can be quite complicated. We have dysentery, where there's passage of blood in stools. We have the persistent diarrhea, where they stool at least for a period of up to 14 days, having this passage of watery stools. We have the chronic diarrhea that's usually long-lasting and recurrent. How do they get these organisms into their system? It's usually through the fecal-oral route. So they touch these surfaces and they introduce the inciting organisms into their systems. Contaminated food, contaminated water, contaminated objects. That's one of the commonest causes. And then some of the etiological agents include bacteria like E. coli, Shigella, viruses like rotavirus, and parasites. I want to use this opportunity to say that teething on its own does not cause diarrhea. In teething, their gums begin to itch them, and then they are tempted to put their fingers, put objects into their mouths, introduce these organisms, and then they begin to have diarrhea. So it's like an indirect way. We want to find out the severity of dehydration in these children. In assessing for dehydration, we check their mental state. Are they alert? Are they irritable or restless? Are they lethargic, weak? Some even become unconscious. We also want to check for the electrolyte derangements in these children. In treating diarrhea, we want to ensure that treatment begins at home. To prepare the salt sugar solution, we use a level teaspoon of salt and 8 level teaspoons of sugar, and you pour this in 1 liter of clean boiled water that has been left to cool. We recommend that you have at least 1 sachet of the WHO recommended therapy at home, and you pour it in 1 liter of water too. Please do not use more and do not use less. It is very important that the child gets exactly what has been recommended for him or for her. We encourage the use of zinc supplements for these children. Zinc helps them to regenerate their epithelial cells. It also reduces the frequency of stooling, and it prolongs the duration before they have another bout of diarrhea. Please, I want to point out that we do not use antibiotics routinely to treat diarrhea in children, except in specific situations. We also do not stop diarrhea abruptly in children because these organisms produce gas, and we want them out of their systems. If they get trapped in their system, they continue to produce this gas. Before you know it, their abdomen becomes distended, they look bloated, and it can actually be a problem. So please do not let anyone give you medications to stop stooling abruptly. We see that a lot when we see them in the hospitals. In preventing diarrhea, we encourage exclusive breastfeeding, giving breast milk alone for 6 months. No water, no additives, except the child is on some medications that have been recommended for him or her. We encourage hygiene. Please wash your hands when you want to change your diaper. After you change their diaper, wash your hands when you want to prepare their food. Visitors come to the house, encourage them to wash their hands. Please make sure the surroundings are clean. Do not allow contaminated objects and surfaces around them. Encourage immunization. Please make sure that they get their adequate immunization. I hope that you've been able to get some points today, and hopefully we'll be able to raise healthier and happier children. Do have a great day. Thank you.